Menstrual hygiene is a vital aspect of health and well-being for women and girls who menstruate. It is a basic health and human rights issue. It involves using clean menstrual products, maintaining proper hygiene during menstruation, and ensuring safe disposal of used menstrual products. Promoting menstrual hygiene is not just a health issue, but it is a step towards gender equality, education, and inclusive development. However, despite being a natural biological process, menstruation still seems to be surrounded by stigma and misinformation in some parts of the world. What are some of these challenges in menstrual hygiene management, and what can be done to break the stigma? These are some of the issues we shall be looking at on the program Nigeria Today. Thanks for joining us. I am Victoria Clinton. Now, with me in the studio for this conversation is Jane Bevan. She's the UNICEF Nigeria Chief of WASH, which WASH stands for Water, Sanitation and Hygiene. Thank you very much for coming on Nigeria Today.
Pleasure to be with you.
And also with us in the studio is Ruth Agulobi. She's the founder, Achieve Her. Thanks for joining us on Nigeria Today.
Thank you so much. Thank you.
So I know we've talked about menstrual health and hygiene briefly on our introduction, but Jane, talk to us. When we say menstrual hygiene and health, break it down. What exactly are we talking about?
Well, thank you so much for the question. It's really it's quite a broad subject, and it cuts across many different sectors. So it's a health issue, it's an education issue because girls in school need to be aware of it. And it's also a wash issue, a water and sanitation issue, because if we don't have, for example, in schools, good toilets where girls can go and change their pads, we have all sorts of problems and girls tend to drop out of school. So it really is a whole range of issues, from safe use and disposal of the products to cleanliness and hygiene. It's about hand washing, but it's also about pain management because periods can sometimes be uncomfortable.
Okay, now Ruth, talk to us. She's talked about this issue, this topic being a very broad topic. Now, why do we need to have conversation about menstrual, when it comes to menstrual health?
Okay. So today happened to be the World Menstrual Hygiene Day, right? And we had an outreach in 3 secondary schools in collaboration with the Federal Ministry of Youth and other organizations. And we were in the field today, and some of the stories from the field speaks to the essence of this topic, because some girls they don't understand the nitty-gritties around menstrual health. They don't understand how to take care of themselves. They don't understand the aberration, the abnormalities around menstrual health. So it is good that we talk about this thing. So when there is an aberration, when there is something outside the normal, these girls know about it and then raise an alarm on time and speak to their guidance and counselors and also their parents. So it's important for us to talk about this. And younger girls are seeing their periods. Younger girls, we found out, research is currently going on that menarche is increasing rapidly, and these girls need to be educated about their period. So it is important. That's the essence of it. Thank you.
Now back to you, Jane. It is important we have this conversation because younger girls are having, their menstrual flow. I've noticed over the years that parents don't really, or mothers, if I say parents now, the mom, they don't really talk about these things until when it happens. When it happens, sometimes it takes the ladies or the children or the girls unawares. They just see these things, they don't know how to handle it. And some of them come down with painful menstruation, like you mentioned earlier. What should be done when situations like that arise?
Yeah, it's a really good question, and the answer is that we should all be talking about it on a regular basis. It shouldn't be hush-hush, it shouldn't be a taboo. If it's a regular part of normal conversation, when a daughter asks, what is one of those? you explain to her, no matter the age, because really we should be, as you say, expecting primary school age children to begin their periods, and so you can't wait till teenage years, which I think some people delay discussing these things. I think it's important to have the conversation as soon as possible when you think it's potential that a girl might be having these, because it's such a shock and a scare, you know. People think they're sick, they're dying, something terrible is happening, whereas in fact we know it's a normal biological process. And I'd just like to add that it shouldn't just be mothers. I think it's really important that fathers, that brothers get involved as well.
I was about asking that. Is it important that the boys also get involved in this conversation?
Absolutely. So it's important that fathers are supportive, because that's one thing we've found in our surveys of girls across the country, is that they don't feel they can talk to their fathers so much about it. So dads need to step up.
Even some men even are very uncomfortable. You're talking about menstruation and say, no, go to your mother, go to your mother. So, you know, he won't blame the girls not wanting to go to their dads.
No, and mum might not be there. Mum might be at work or somewhere, and dad needs to step in, or brother needs to step in. But I mean, ideally, you'd find out from a girlfriend, a sister, a mother, a teacher. But yeah, we need to talk about it.
Now, Ruth, you know, like Jane said earlier on, she said that, you know, it shouldn't be something like hush hush.
Yes.
But we see, you know, some parts of our societies, you know, people doing this thing as if it's a taboo and all of that. So what are some of the misconceptions that we ought to address concerning menstrual health?
Okay. Thank you. That's actually a beautiful question, because one of our placards today was saying, don't whisper. Menstrual hygiene is not a stigma. So when we start bringing in the men, like Jane mentioned, those stigma, misconceptions and myths will be changed. So from the field stories we got today, one of the girls was telling us that she saw her period and then told her mom, and her mom said, go tell your dad. And the dad got the pad for her. Nice. So those are the misconceptions that we should start correcting in society. And it's also good that when we are having this conversation, we should have everybody in the room. Because when we have everybody in the room, the girls wouldn't be shy. Because why are they shy? They're shy because the boy is there. Do you understand? So it's really good if we have the male in the room when we're having this conversation, and all misconceptions and all myths around menstrual health and menstruation, because some of the myths could include some, I don't know, I think some parts of some people says, oh, you don't come here when you're seeing your period, you don't eat this when you're seeing your period.
Some cultural and religious barriers.
Yes, I was being careful not to, some cultural and religious, all of those we should start talking, reorienting. We should learn and relearn, unlearn all this and change those misconceptions of those cultural and religious barriers to people coming into certain spaces to belong and feel safe because they're on their period. So we should try to actually cut all of those and ensure that we speak to this loudly, especially our policies. We should ensure that our policies allow women to be free and to attend to social functions when they're seeing their period. So those misconceptions should be corrected. Thank you.
So Jane, tell us, you're talking about hygiene. What is a woman supposed to do, or a young girl is supposed to do when she is seeing her menstruation? Because some really don't know how to handle it. You see some girls coming down with certain stains here and there. So how should they handle it?
Well, it's good to know that it's regular. So it's every 28 days, as my MH Day bracelet says, representing the 28 days. And it's really important that we can predict then when your period is expected. So yes, the very first time it will be a shock and surprise, but the next month it should be regular, so you can predict when it should be. And then it's important that you have a supply of your product that you want to use, be it a pad or a cup or a tampon, whatever, so that you make sure that you can deal with it. And you need a safe place to go to use those. So you need a toilet that is clean and light and with a lockable door so that you can change and clean yourself in privacy. It's very important.
Now, we'll take a short break now. The conversation will continue after the break. Don't go away.
The implementation of the ruling is also dependent on another aspect or another arm of government.
Nowhere in the world will allow under digital economy for banks not to be dispensing domestic currency in that economy.
What will make this one different? We want to know what they do as occupation. All of these are attributes that are questions have been designed to investigate.
In a few days to come, you see that we are all around their own crannies and everywhere in Nigeria, telling people to cooperate.
Welcome to Nigeria Today. Welcome back. This is Nigeria Today, and we're looking at menstrual health and hygiene. And of course, I have two ladies here in the studio for that conversation. So, Ruth, I know Jane has talked a little bit about it, but I want you to give us more, walk us through what how a lady should, how often should a lady change her pad?
Okay, so again today, like we had rightly done on the outreach field today, we spoke to the girls about changing their pad often. So you can change your pad at maximum, at least twice in a day for hygiene's sake. It's important, it's a very intricate part of the hygiene of a woman for you to keep a very hygienic environment and on yourself as well when you're seeing your period, because there is, as a medical professional, I'm a nurse, it's important because as a woman, we are open. So there are tendencies of bacteria and infection happening when you don't take care of yourself. So it's important that there is the component of hygiene when we're teaching these girls about their period. So we taught them how to use the pad. We taught them the sequence of the number of times the pad should be used. We taught them how to properly dispose. It's one thing to use in a hygienic way. It's another thing for it not to cause environmental harm to people around. So it's how to properly dispose when they're using this. So it's important they change their pad, which is the paramount thing. Change your pad at least twice in a day, but you can change as much as 3 times because ladies, their flow differs per person. Some people have heavy flows and they have to change up to 5 times or even 10 times in a day. So it depends on your the flow, the intensity of your flow, and it helps. It's also important to have the pads. Yeah, some girls don't have the pad to change, and that's why we are also augmenting with the reusable pads, which we're teaching the girls how to make and how to also use, because there are some pads that are less expensive to use because some girls can't afford pads. There is period poverty everywhere. Some girls can't afford pads.
So what can such a person do when you say, okay, if the person can't afford pads?
So in underserved communities, what we are preaching about, we're looking at cases in Bauchi where we're having conversation about the pad banks, and we're also talking about teaching these girls how to sew. It's also a way of empowerment, which we're empowering some women in those communities that know how to sew. They sew these reusable pads, and then it helps them during their periods. And what they have to do is have up to 8 of those pads, and they wash. Once they wash, it's getting dried and you're using the other ones. So in those cases where they don't have the money to buy pads, we're talking to them about taking ownership and then having to create those pads by themselves.
So how hygienic are those reusable pads?
Okay, so in terms of hygiene, those reusable pads, when you use them and then spread them in the sun, the intensity of the sun help to kill the bacteria. And we also encourage the girls to use antiseptics while they're washing it. So it also helps to kill any bacteria that are inside those pads. It's not 100%, but it's something. It's a step in the right direction, because we can't wait for the government to have those pads brought to them in the community. So in cases where they don't have the money to purchase the actual pad that they're supposed to use, they have to use something. And it's not safe to use those hanky, those towels, those tissue papers. It's not safe. So it's important that we look for alternatives that would help these girls just to save period poverty. Thank you so much.
Okay, Jane, she talked about tissue, because I was coming to that. Tissue, how dangerous is it for a girl to use tissue?
It's not dangerous in itself to use tissue, but it is if you don't change it, or if you are not regularly replacing. So obviously, if that's all you have, that's what you should use.
Okay, so tell us, how dangerous is it for a girl not to be, to maintain proper hygiene during menstruation?
It's not dangerous. Let's tone it down a little bit. I mean, it's not going to kill you, but yes, it could be unsafe if you are continuously unhygienic. There's a potential that you could get an infection, and then yes, that could lead to urinary tract infection, for example, which isn't nice. But on the whole, it's just good to keep clean, and it feels nicer too.
So how important is it for girls to also wash, remembering the water, sanitation and hygiene during menstruation? Very good.
Yes. It's definitely important to keep washing.
Ruth, talk to us the importance. I know we've mentioned it earlier on. The importance of having this conversation with younger boys, not just girls.
Yes,
both. The younger boys, because some of them sees a girl, what's this? And they off they go. They run away. So tell us how important it is.
Okay, that's actually a very fantastic question, because some days back I was doing a design for a flyer, and the graphic designer was, what is this? I said, it's a menstrual cup. I was like, menstrual what? Menstrual cup? What's a menstrual cup? So he's way older and he doesn't know anything about menstrual cup. That is not nice.
So what's menstrual cup really?
Oh, menstrual cup is one of the menstrual products or menstrual materials you can use when you're having your flow. So you have the, like Jane rightly mentioned, you have the tampons, you have the sanitary pads which we're using, and then we have the menstrual cup. It's a shape of a cup, like you can just insert it into your system, and then it just collects all the blood and just take it out. So yes, it just collects it in a portion and just take it out. So yes, that's a menstrual cup.
Okay, now talk to some of the ladies out there that refuse to wash themselves properly. Have a bath really. During menstruation. You see, just speak to that issue, because it's a big problem.
It's one thing for girls not to take care of their self during menstruation. It's another thing for the things to use to take care of themselves to be available. Now, bringing us back to the conversation on water, sanitation and hygiene. These things are intricate parts of menstrual hygiene. When you go to communities, they're using dirty water. It's not safe. So it's important that water is available in communities. We need to go into those communities and ensure water is available to these girls. Because to be honest, these are things that affect the public health situation of the country. So it's important that water is available, because I would want to take care of myself if I'm menstruating. Nobody wants to not to take care of themselves. So it's important that all of these things are available. The wash facilities, the hygiene and sanitation facilities, I beg your pardon, the conversation around water being available. It's important. It can never be overemphasized. It's very important for them to get it. Not deviating from the question you asked me. if you have these things available, it's also important that you keep yourself clean. Like Jane has rightly said, if you don't keep yourself clean, there are infections, there are different kind of, we don't want to sound dangerous, like she said, but it's important. You feel safe, you feel healthy, you feel more comfortable when you keep yourself clean.
And also you keep other people around you safe, because it comes with certain kind of
offensive odor. So I remember then when I was in the boarding house, there is this particular girl close to my bed space. She usually oozes during her menstrual period. So it's important, sorry to use that kind of word here, but it's important that people wouldn't want to associate with you when you don't keep yourself clean. So it's important that every girl, when you're seeing your period, you keep yourself very clean. Yes.
Yes, and it's very important that the next person doesn't find out you're actually menstruating.
Yes.
Because some persons, immediately they start, you just know. Not because they tell you, or because of course some come down with pains and all of that, but because of the way they package themselves. They don't really do that very well. So Jane, talk to us. What is UNICEF doing in terms of providing the wash for people in the rural areas and underserved areas, like Ruth mentioned? There are people that do not have access to these things. So
there really are. There's a lot of people that don't have access to toilets, for a start. Estimated 23% of the whole country don't have access to toilets. And many schools and even primary healthcare facilities, amazingly, don't have safe toilets. So it's a really important issue. What UNICEF is doing is working with the governments in various different states to try and improve that situation, to really build systems, to really build systems around systems that build the strength of all of the different organizations that are involved. So it's water, it's health, education, all of these different sectors need to get involved to really help to build the toilets. And I think in schools, for example, health clubs, hygiene clubs are very important, not just for girls, for boys as well, so that everybody understands what's going on and you can talk about your worries and your fears with your peers, and really understand a bit better what's going on and learn from others' experiences. And then, of course, facilities and building toilets, and really thinking about menstruation when we build those toilets. So girls need privacy, they need a slightly larger cubicle so they've got space and a waste bin, and they need a lock on the door so that they can have some privacy.
Okay, and Ruth, in 30 seconds, tell us how unsafe, I don't want to use the word dangerous now, just like Jane said, how unsafe is it for a girl or girls not to properly dispose their used menstrual product? That's one. Secondly, advise the girls out there on how to properly take care of themselves.
So thank you for the question. Let me go to the first questions. In order to keep everybody safe, because air pollution is a public health issue. When you improperly dispose your pad, it's a public health issue, because the next person will find it very offensive. Menstrual blood, it contains a lot, and all of it put together can cause offensive smell. So it's important that you properly dispose your pad in probably a black nylon or wrapped in something, and then dispose in a waste bin. So keeping yourself clean during the period is important. And my advice to everybody out there around menstrual hygiene is, like I said earlier in our research at Achieve Her, where we are getting to find out that younger girls the menarche is starting way earlier. So we need to start having the conversation way earlier and looking for, and there's a new model we adopted in Achieve Her. It's called the period ABC. Flashcards, amazing flashcards we're using to teach younger girls in a more exciting, engaging and fun way of their period, about themselves, about hygiene, about everything that has to do with taking care of themselves. So my advice is we start this conversation early, as mothers, as fathers, as brothers.
Thank you so much.
Start this conversation early. Thank you so much,
everybody. Ruth Agulobi, founder, Achieve Her. Thank you so much for coming, sharing your thoughts with us.
Yes.
And also we had Jane Bevan, UNICEF. She's from UNICEF, and she's representing, she's UNICEF Nigeria Chief WASH, which is water, sanitation.
Thank you.
And
hygiene.
Hygiene.
Thank you.
And thank you for being part of the program. I'm Eukaria Clinton. Goodbye.